Y'all, I just did like a whole nother 40 minutes of footage explaining my experience, and the footage was defective. Ugh, so annoying. So I cleaned my whole kitchen and everything. All right, I really want to get this out to you guys. I really feel like I owe you guys an update. So I'm gonna repeat myself. Hopefully I'm able to explain it the same way I did in the first round. I did a test to make sure that it's not defective anymore. So annoying. But okay, last thing I said was, I'm not surprised people want to do labor and delivery because it's a rewarding job. Now, the thing about labor and delivery is that there are cases where things don't go the way you want. Babies are born with issues. Babies aren't born at all. Babies die in childbirth. Babies die after childbirth. Babies die in the womb. There's a lot of issues with that, so that's the sad end. But honestly, there's always going to be death involved in any kind of nursing, I feel. So it like comes with the territory. But yeah, so my classmate saw the live birth and she was just like in awe by it and was like, wow, it's completely different from giving birth. It's like a whole nother experience. And she's like, now I want to be a labor and delivery nurse. So yeah, so I was like, you know, it's funny. So I got to see a circumcision, which was interesting because it was disgusting. It was gross. It was hard to watch. And it actually made me feel like, ugh, if I ever have a son, I don't even want to make him get a circumcision. I probably will though, but I don't, because I think it would be helpful in the long run. But the actual like procedure for it is really, gruesome. And I got to see a C-section. Now that was really interesting because the C-section was, it was crazy. It was like, basically the mother started declining. And the thing about a C-section, which is funny, because I never knew this before, anything could be going wrong with you. You could just not be in ideal condition, and they will try to resuscitate you. Not resuscitate you like, oh, you're not breathing. I mean, like, they'll try to just fix whatever it is that's not working or not going as planned. And if you don't respond correct the first time, you get a C-section, okay? They don't play. You're getting your ass getting a C-section, okay? So the patient was declining. The baby's heart rate was jumping low. Turned out the umbilical cord was wrapped around the baby's neck, which actually is a common finding. Don't mind me, I'm cleaning my floor by hand, the Cinderella way. And she was declining or whatever. And so she was an emergency C-section. And so, they literally, it was nice to see because all the doctors were black. I love to see it, okay? But anyway, so all the doctors, there was like the head surgeon, I guess the assistant, the person who used to pass all the tools and all that. They literally get her in there. She luckily already had epidural, so they didn't have to like give her any pain meds for real. It was like actually good for her because they were able to move faster. And yo, they sliced her skin. The first thing you see is fat. And fat, subcutaneous fat looks exactly like how they like show you in pictures. They slice open the fat, then you see the muscle. The muscle looks exactly like the picture too. I was like, yo, they slice open the muscles. They rip open your muscles. I mean, rip open the muscles. Like, they rip them open. It's crazy. It looks crazy. They rip open the muscles. They see the uterus. They slice the uterus. And then after that, they pull the baby out. Baby was a little blue. She was a little blue. And, she, you know, because the cord was wrapped around her neck. And they pulled her out, they cut the cord, they bring her over to the table, and then they start to like, what is it called? They start to sew up the uterus. That took like forever to do. It took like 5 minutes to get that baby out. It took like an hour for them to re-sew her because they have to re-sew her layer by layer. reseal the uterus, make sure it's not bleeding, make sure it's good, make sure they press down on the fundus, which is the uterus. What else do they do? Then they have to sew back her muscles, sew back the fat, so for real, sew back the skin. They had to sew everything back layer by layer. It took like an hour, and they have to count all the everything, like all the tools. They have to count every single one, even the tissues that they use to like wipe off the blood. They have to count. Well, first of all, they count all of them beforehand. They have to count all of them at the end, because apparently there's been cases where people accidentally leave like tissue, like bloody tissues from like cleaning it off in the body, and it'll make the mother septic. There's been cases where women have died and gone septic because they've left bloody tissues in the mother's womb or in the body, in the mother's body, because they didn't count all the tissues after. It's crazy. I didn't even think about that. So they do that. And it was so sweet because the father came in and he was so excited. He was like, oh my God, my baby, like this is amazing. Look at what we made, she's so beautiful. He was so excited. It was so sweet to see. It was like a lot going on though, because it was like this beautiful, emotional, sweet moment in the corner. This screaming, pale baby, this bloody mother whose insides were inside out. Like it was like, I'm just standing there looking around, nurses running around, bloody tissues. I was just like, wow. It felt like I was in a whirlwind. It was a cool experience in the C-section. I pray I never have to have one though. Because they are, woo. It's major surgery, y'all, for real. When they say it's major surgery, they mean it. That's why I don't get moms who are like, oh, I don't want to push out a baby. It's major. I just rather have a C-section. Just take it out. It's not that simple. I would much rather deliver vaginally, which is natural, and you recover so much faster, than do a C-section, which is so much more intensive. So yeah, so that's that. I saw that, and I dissected a placenta. I did cool mother-baby assessments, so that was cool. I got to assess babies and bathe them, and it was a little cute. Got to assess the mom and make sure she wasn't bleeding, make sure her fundus or her uterus was contracting right. I don't know if I said this already, so I'm just repeat myself, but like what's crazy is like there's just certain things you just don't realize you don't know. Like there's things about being like because like I don't know, there's certain things you know, you feel like you know, because it's like common sense. Like everyone knows like moms can die in childbirth, like it's the closest thing you can get close to death. Everyone knows that. Everyone knows that like you could bleed out and all that stuff, but you never really think about how exactly. You never really think about like what it entails. Like you're just like, oh yeah, like complications happen. So here's something you learn, and this is what I mean by like common knowledge, where you're like, yeah, moms can die in childbirth, versus actual medical learning stuff. So I never knew that like basically when you're giving birth, your placenta, right? You give birth to the placenta after you give birth to the baby. You know that the placenta is like the portal basically between you and your baby, and it provides your baby nutrients. So you have to give birth to it. So what do you think happens to that space after you give birth to the placenta? You don't ever think about that. Basically, it's a gigantic womb in your uterus where your placenta used to be, where it houses a bunch of blood vessels that went into the placenta, into the baby to feed it. So when you lose your placenta, you have this gaping wound in your uterus. Now, your body naturally knows to like shut down and basically like cauterize it or clamp down on it to like basically close the wound. But what if your body doesn't do that? Then what? Your body usually, like I said, cauterizes it off so that you don't bleed out. But what happens if your body doesn't do that? There's so many things that can happen to prevent that. So like, maybe you're not getting enough hormones that tell your body to clamp down on that. Maybe you have pieces of placenta still stuck in your body. If you still have pieces of, like if the placenta breaks apart or breaks off and you still have pieces of placenta in your uterus will not be able to clamp down on itself to cauterize that wound. And what's gonna happen? You're gonna bleed. Even if you have too much urine in your bladder, the pressure from, or the space that your bladder takes up can prevent your body from being able to clamp down on that wound to cauterize itself so you don't bleed. So if things like that happen and your body's not cauterizing itself so that you don't bleed out, you're going to hemorrhage. And that is a big part of how women bleed out and hemorrhage during childbirth. And I just never thought about that. And there's just so much you learn that's really cool. So yeah, like my clinical was really cool. Even though I wish I got to see more, I still feel like I saw quite a bit and I learned quite a lot. And my professor was amazing.